6:20 in Trinidad and Tobago. Very kind of you to be with us. If you are in a holiday period still, enjoy the relaxation. If you're out to work, if you're heading out to work in a short while, very kind of you to be with us as well. So let's get another perspective on the COVID-19 situation, because again, it is paramount. We're talking about lives, we're talking about livelihoods, we're talking about managing a situation that continues to develop, continues to transform. 25 deaths reported yesterday, 30 deaths reported a couple of days earlier on Christmas Day itself, Boxing Day, a number of fatalities as well. And again, I wonder if we're being numbed by all the numbers. How many new cases? Who with comorbidities, who with no medical situation at all. But let's get a perspective from someone who's been speaking out quite a bit on social media about the management of this situation. He is a medical professional. He is the former health minister, Dr. Fouad Khan. Dr. Khan, thanks very much for taking the time to join us on this Tuesday morning.
Thanks for inviting me, Fazil.
Good to have you with us this morning. What is your perspective on the management of this situation? Because if I could just preface by you saying months ago, in fact, more than a year ago, that all of these restrictions were either unnecessary or should not have been done, that you need to open up the economy and so on. Given the level of deaths we are seeing right now, Dr. Khan, do you stand by what you were saying more than a year ago?
100%. Because, Fazil, if you look at it, when you confine people to a closed place, you are going to promote the disease more so than anything else. When you confine and you lock down, and what you do, you are going to make sure that the economy crashes. Now, everything is being done to focus on the deaths that are occurring. But people are counting the deaths and they're indicating to you that the 25, 30 deaths, etc. But has there been a proper audit of the management of the patients, which is the medical management, the management of the audit of the system of COVID management by the Ministry of Health? Nothing like that is taking place. We don't really know what is the real cause of death of the patients. Is it their coexisting illnesses with COVID? And we are making rules and regulations based on the number of deaths. Now, I still stand by it. Had we opened the economy and go through the precautions of mask wearing in closed spaces, and I stress that, mask wearing in crowded areas. You can't expect somebody to be walking in the middle of the road with nobody around and wearing a mask. And that is the kind of regulations that is really questionable. Now, the economy is, crashing. People are out of jobs, etc. So, and they are COVID fatigue now because you've locked them down to such an extent. Now, pray tell me, when you open a beach between 5 and 12, don't you expect the majority of the rush to take place then, the majority of conglomeration, people are going to be close together in that specific time? Had you opened the place and police it properly, allow the rivers to open, allow the hikes to take place, you can't hike with a mask on, but you could take precautions of distance. People have to go out into the open atmosphere, breathe deeply, get air into their lungs, and if you know the old days of tuberculosis, you would have known that people would go into certain areas to get fresh air. And everything is being managed in a sort of a box. Now we go to the medical management. If you have so many deaths occurring in elderly people coexisting illnesses, have you done an audit to see if your doctors are experienced enough? Are they seeing about too many patients at one time and there are kinks in the treatment? Are the people dying from neglect? Are they dying from lack of proper care, specialized care? None of that audit is being done. So you're just rolling out numbers on a daily basis. You're making regulations based on your numbers, but you're not auditing your systems to see if what is occurring is really occurring.
And Dr. Khan, if you would allow me to jump in there, as far as that auditing, Just elaborate on that for me a little bit, because I am aware,
Okay.
and I think many of us are aware as citizens of somebody falling, let's say having a stroke, for example, going into hospital for the stroke, then picking up COVID in the hospital or testing positive, and then dying and being classified as a COVID death.
And that is what I've been saying for months, Fazil. I've been saying that for months, that where are the proper cause of death and the autopsies? Where is the audit? Where the audit system is like a normal accounting audit, but we do a medical audit. You take the patients who have died and who are long COVID or whatever it is. You have meetings with seasoned and specialists and professionals of that problem, which is cardiologists, nephrologists, and critical care management, and you go through the notes and you check to see if the doctors if they prescribed adequately, if the patient was taken care properly, if he had enough oxygen, was the oxygen concentration enough? Did he have it on time? Did they get the proper ECGs? Did they get the proper blood tests? Were there other blood tests you could do? Were there other things that could happen? Did they get any physiological chest assessment? Did they get functional capacities? Did they get these things that caused which if they had got, would not have demised? That's an audit. It's not a witch hunt. What you really do is to audit the treatment plans, audit the treatment systems, and see if what you did was correct or you could have done more.
Is that normally done, Dr. Khan? Pre-COVID times, would that be normally done?
In all developed hospitals in the world, an audit system is done to make sure you don't continue making the same mistakes you made before.
So the answer is no, then, that we don't do auditing.
We do it in pathology and those things in meetings. But in England, when I was there 25 years ago, we did it every 3 months on ourselves. We would come together and bring the cases and say, we messed up in these cases. What could we have done better? And we took the complicated cases and ones that died, etc., and we, through our peers, our seniors, everybody sat together and we had a whole day of checking to see if our systems were good. And everybody came out of that and learned properly. Now, all these deaths occurring, we would have found out if other things could be done, were these deaths preventable? Could we have done things differently? And an audit system needs to be put in place. I tried to put an audit system in place when I was minister, but it was pushed back. Now,
why was it pushed back? Why you were health minister under People's Partnership Administration? Why was it pushed back then?
People were afraid it would be a witch hunt, so they did not participate. They didn't bring it out. The doctors thought that we were trying to witch hunt to get rid of them. That wasn't so. What we are trying to do is to audit our work to see if our work was up to international standards and could we do anything better. Now we have all these deaths. Now when you look at the demographic of the deaths, they are elderly people with 3 and 4 coexisting diseases. And Fazil, I will tell you something. I want to share something. There was a gentleman came to me 2 weeks ago. He was 40-something from Tobago. He was not treated of his kidney stones in Tobago. He had 2 ureteric stones blocking each kidney. I tried to rush him into the operating theater in St. Augustine because he needed to get decompressed, right? On the Sunday when he was coming home for the operation, they have to do a COVID test before operation. He was positive, but he had no symptoms. He ended up, we couldn't do the operation because the hospital did not want me to do it. Now imagine a man with 2 blocked kidneys and minimal urine coming out. Sepsis, which is infection, would take place. So I had to decompress him fast. I could not do it because he was positive PCR. Now, I told the wife to give him antibiotics and see, let's see what happens and rush him down. If there's anything, I'll try to push him through. In hospital, he says, COVID positive, can't do nothing until he's negative. The man is 40-something with 2 small children. He ends up in Tobago Hospital with fever, ends up there, and after a while was ready to come home, dies within the last 2 weeks. Wife called me on Christmas Eve crying. he died from fever, and he died, and they say it's heart attack. He died from sepsis, and because he could not get his medical treatment, surgical treatment done because he was positive PCR. He did not die from COVID, and that's what's happening in the system.
But and we keep hearing this, Dr. Khan, and you know the point is, what is the justification for this? Because surely, if the situation that you're presenting is correct, and I have no reason to doubt what you're saying, and as I mentioned, we've heard about other people in similar situations falling ill for other reasons, and then when they go to the hospital and they test positive for COVID and they succumb to whatever happened to them previously, but are classified as COVID deaths. Why is this still happening?
And they're going to a COVID stream of treatment by inexperience, but not, when I say doctors who are not as experienced as a senior specialist. If somebody goes with a cardiac problem, a heart attack, and he tests positive, he will be put in a tent and sent to Couva and treated as a COVID patient. He has a coexisting morbidity, he has coexisting stuff, and he dies as a result of it. Now, the thing about it, we have to audit our system to see if we are making serious errors.
No, but I hear you about the auditing part, but as you said correctly, this is done from your experience in the UK periodically and so
all
on.
Over.
But I'm talking about right now. So let's say, for example, somebody fall down and hit the head hard, and they suffer a serious injury, a life-threatening injury. They go to hospital and they test positive for COVID, and they die from the head injury, but are classified as a COVID death. I mean, how could that be explained?
And then they bump up the numbers with that death. All those deaths are taking place, and the government now comes and makes regulations based on those numbers. That's what they're making regulations on. They're not making regulations on the actual COVID death. That's why you hear some other place, let's say Jamaica or some, I see they get how much thousands of cases a day, but 2-3 deaths, because they obviously counting it correctly.
But Dr. Khan, you are a medical professional of many, many years standing. Where's the medical association in this? Where's the medical council or whatever the name is? They just sit by and let these things, if it is that they are being misrepresented as far as the numbers of actual COVID deaths, is that all well and good for the medical profession?
I will tell you something. The majority of senior specialists like myself and others, they have no input into the medical board. They have no input into the medical association. And as a result of that, the system is fragmented where that is concerned. It's not as organized. Now, the thing about the reason I'm pushing for the audit system, then you will be able to tell quite successfully that where the problems lie. But nobody likes their work being audited. They run from that because then you will expose negligence, you'll expose mismanagement.
But Dr. Khan, if you'd allow me, sorry to keep interrupting you. We're going to have a break in a short while, by the way. Why should doctors resist being audited? Because everybody else is. Everybody in public life, their health account. What about are doctors above being audited or having their work being assessed? Not to target or victimize anybody, but just to check
it out.
But why? Why are they resisting it?
People are afraid of medical negligence. Lawyers are waiting on the back door, the front door, waiting to sue doctors because there's a lot of money in it. And doctors do not go to court, although 85% of doctors win medical negligence cases, but they settle out of court. And it's a whole, but right now we're in COVID present. People are dying as a result. We have to find, and regulations are being made to affect the whole country. It's destroying economies, it's destroying lives. The mental health of children has gone to the chute. Because imagine a 12-year-old child cannot go to a cinema, cannot go to a beach. Well, now they can go to 5 to 12, cannot go to a river, cannot go to a playground, cannot go to a safe zone. So a 12-year-old child is stuck in a house, in online school, and has no input of his peers. Now,
Dr. Khan, just pause. Hold that thought for a moment, because we have to fulfill a commercial obligation, and we'll come right back. Just remember where you paused in your observation as we continue our discussion. It's now time, though, at 6:35 to remind you of the COVID-19 protocols. Wear a mask over the nose and mouth when you go out in public. It is, of course, the law. Keep your distance from others, 6 feet or 2 meters. Stay home if you're ill. Wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Cough into a tissue into the crook of your elbow. Avoid touching your face. Sanitize those hard surfaces, tabletops, handrails, doorknobs, trolleys and cell phones as often as possible. We'll return to our dialogue with Dr. Khan right after this. .39 coming up towards 6:40 in Trinidad and Tobago. We're trying to make sense of the numbers in relation to COVID-19, the deaths, the infections. We have medical professional Dr. Fawad Khan, former Minister of Health, with us. Dr. Khan, when I interrupted you to fulfill those commercial obligations, you were making the point about children and so on being in basically locked up. The challenges of online learning and so on. But I don't know if you wanted to develop that point before we move on to another issue.
Look, when children are not interacting with their peers, their development is stunted. The mental status is affected. So you have now, for 2 years, young children being locked away, right? And for their own good, of course, without interaction. So you end up with a deficient individual now, and without any ability to enjoy themselves anyway. So you are going to get the mental status of children in decline. And people do not look at children having mental health problems, but they do. And the thing about it is that it's not recognized. You have to really push at it, because they're not like adults, but they don't understand it. So we are pushing our children into serious mental health depression. No, they may say it's for their own good. They may say it's for their own good, but because they're not going to spread the disease, etc., etc., etc. And now Omicron coming out, and whatever it is. But Omicron seems to be milder. It seems to give you a higher amount of immunity, and we have to now deal with the times. Now, another thing, Fazil, I wanted to say. Sorry, the Attorney General. The Attorney General and the Prime Minister has mandated that public servants get vaccinated by X date, 2 weeks, I think, or 2.5 weeks, or then can't come to work or lose their pay, or pressure them to do PCR testing every 48 hours or something like that. Now, what is the demographic of the deaths? Between the age of 18, which is a public servant, to 55, very few deaths occur, unless there's coexisting illnesses. After that, the deaths increase because of coexisting illnesses. I don't want to use the word comorbidities, it's become bashed around. Coexisting illnesses. You die 60 onwards. Now, a public servant act is between 18 and 55 maximum. That's the highest amount of them. Why are you pushing them into a corner to be mandated, vaccinated, or no pay, when that is the demographic that is not dying? I mean, I want somebody to answer me that.
Well, if I could offer a response, because hasn't it always been vaccinate from the very outset? And indeed, this government was singing the song in June of this year, vaccinate to operate, to minimize the spread to the more vulnerable in our society.
Well, Fazil, you can make slogans, yes, and you can promote what you're going to do, but you have to look at the science. If you're looking at science, what you have to do, the Prime Minister or the Attorney General should say, those who are high coexisting diseases, those who are morbidly obese, those who have immunosuppressed diseases must be vaccinated. You cannot tell people who don't have any illness, who between the age of 18 and 45 or 50, who have with a disease process that has a 95% recovery rate, to mandate them to vaccine or lose their pay you're now becoming dogmatic and are becoming totalitarianism.
But Dr. Khan, can you actually do that? Can you actually say somebody, look, you too fat, you have to get vaccinated or you can't work? Can you really do that?
Well, the thing about it, if you want to really and truly treat your population, you have to, you can't just carte blanche say, because it's like the rubbish they do with the PH cards. PH is illegal, but they made a law for masks in your car with your wife and your children because PH drivers might have people in their car. And they mandated it. So why? And they mandated foolishness because in the United States, when I was there, you're driving your car with no mask on with your family. Now, you take your own precautions if necessary. Now, at the end of the day, the people who are susceptible, and a new study is coming out that the COVID virus deposits itself in the adipose tissue, which is the fat cells, and slowly releases it into the myocardium, which is the heart muscles, kidneys, and lungs. So if you are obese, you run a higher risk of the COVID virus depositing your fat and then attacking your heart, your kidneys, your lungs, and your brain. That is a study is going to come out very soon. Now, if that is the case, yes, you should mandate those kinds of things. You should not go. I have yet to see the Minister of Health or the Chief Medical Officer promote the weight-losing, healthy lifestyles, which is a factor that where a lot of people are dying because of the obesity.
But Dr. Khan, that is not correct. I mean, the health minister has been all over the place on exercising machines, and even long before COVID-19, he's been pushing this.
I was doing that, Fazil. I started that, and he's called, but there's nothing like that now in COVID. COVID, you're supposed to ramp that up. Sorry. Ramp up your healthy diet. Ramp up the reason for this. Ramp up exercising. Ramp up losing weight, because that is what is going to save you.
But Dr. Khan, would it not be argued that if you were to go that way, if you were to say rather than carte blanche everybody in the public service or everybody wherever, that if you identify the morbidly obese or the very very much overweight, or those with as you say, other illnesses and so on, that you will be accused, or you'll have a lineup of lawyers waiting to target you or to sue you for embarrassment or denial of earnings and so on.
No, you're not mandating it. You are indicating to them that these are the problems and these are the people who need to be vaccinated with how much boosters? 3-4 boosters. And you're not mandating and saying, if you don't do that, you're not going to get paid. No, you can't carte blanche people like that, because where does it end? And you have now put the argument forward that where does it end? You can't do that because lawyers will come, etc., etc. Now, what you're mandating, you don't get paid unless you get vaccinated. What I'm saying to you, it's a double tire of discrimination. What you have to do as a ministry, and the ministry has to be out there talking about how obesity causes death in COVID. Make people aware of it. Educate them. Not every day you come on the place and say, 24 people dead, all you see. 25 people dead, all you see. 6,000 people infected, all you see. That's all they're doing. They're not telling you what to do.
But Dr. Khan, can it not be argued as well that, and I mean, we are not unique in this regard, that people just harden. They don't want to listen.
No.
I mean, I was there at Maracas Sunday and Monday, and yes, quite a few people were masked, but a lot of people were not. They may not have been playing music or getting drunk, but they were right in each other's face talking loud, loud, loud.
I understand what you're saying, but what I'm saying to you, the most you could do you could legislate behavior, but people are going to go underground. Prohibition in the United States, where they legislated against alcohol. What did they do? They went underground. They had an underground economy. You are going to get the same thing here. You can't just say, I'm going to legislate people bad behavior. You have to tell them and educate them what is the correct thing to do. And then you hope that they do it.
But so let's talk about that a bit, Dr. Khan. How would you change the messaging? Because again, the government has maintained that they have tried everything. They have tried persuasion, they have tried information, they have popular personalities on TV and other media reminding people to get vaccinated, live healthy lifestyles, and still we have these numbers. How can they do anything different to have more effective messaging?
If I tell you to live a healthy lifestyle and you don't know what it is to do to live a healthy lifestyle, I'm not telling you what the healthy lifestyle to live. Like, okay, let's break it down. I say live a healthy lifestyle. You go back, yeah, go live a healthy lifestyle. What is a healthy lifestyle? You understand? Tell people specifics. 1, sugar is the cause of a lot of problems. Stop eating so much of sugar and read your labels. Look and see how much sugar is in a juice when you're giving it to yourself or your child. Sugar causes insulin resistance. Sugar causes you to get fat, and tell them how. Talk about the fried food industry, the bliss point. Talk about those things and educate people so they can and educate children. So once you educate children, they will educate their parents rather than just saying have a healthy lifestyle.
I hear you on that, Dr. Khan, but hasn't this been done already many times over?
I did it for 4 years, and people were starting to buy into it, and then it stopped. You need to push this in people's head, because the cure for this thing is not vaccination alone. It is your healthy lifestyle. Now, if you tell me I have to wear a mask when I'm walking up the hill, I have to wear a mask by a beach because you don't want somebody to breathe on me, let me be the person to say I don't want nobody to breathe on me, but I want to smell some fresh air. I want to go in the forest. I want to go by a pool and sit down. I want to go and walk somewhere. But I have to be afraid of a police watching me and charging me because I have a mask on when I'm walking around the savannah. It is, people have to understand what you're doing. You don't just do things because you see people bad and they can't listen. No, that's wrong.
All right, and in the time that we have available, Dr. Khan, we have just less than 5 minutes to go in our discussion this morning. And I know you're very active on social media and highlighting a lot of these concerns. Where do you see us going? Because we're coming towards the end of the year. We've just come out of the Christmas period. We have New Year's coming up. We have Old Year's with all the congregating that will take place. Then we're going into what people would still like to believe is a carnival period. What is your concern or your observation or your expectation?
My biggest concern is that the ministry and the government, they're using wrongful statistics and debts without proper audit, and then bringing the big stick approach and the heavy hand approach in everything. They want to say that if you deny people their rights, they're going to get better. No, you're going to push them underground. You're going to get them angry, and they're going to continue doing what they're not supposed to do.
Maybe they feel that's the only way people will listen, Dr. Khan. That because even in my household, people are saying, "Oh gosh, 32 deaths, 30 deaths."
Why they stop eating children if licks does work?
Because it don't work. I can tell you that it don't work. Licks don't work.
Exactly what I'm saying. Heavy hand is licks. Now the thing about it, if you educate your child, if you tell them the right thing, they will do it. If you educate your population, tell them the right thing. And as we have a few minutes, if you indulge me in this, please.
Sure.
My friend Puran Ramsingh passed away on Christmas Day.
Yes.
I want to tell the family my condolences, and I feel very hurt because Puran knew me as a little boy growing up, and we all lived together. I just want to send condolences to the family for indulging me there.
Sure. And here we have again, and when these things happen, because for many people, COVID-19 is getting closer and closer. More and more people are dying much closer to them. So it's not a distant thing anymore. It's not them and us. It's right here. Yet still, you have a level of indifference, Dr. Khan. You have people still happy to eat unhealthy food because they say, well, you're dead sometime, so I might as well enjoy my life.
That's COVID fatigue. But what I'm saying to you, the government of the day has to use their money to push the education of the healthy lifestyle. Let the Prime Minister stop this mask mandate so police could charge you for on a whim, where you could breathe in the open atmosphere. It's been done in Florida. It's been done abroad. You can breathe in the atmosphere. You don't have to wear a mask when you're walking on the street. You wear a mask in crowded areas, on a tube, in different places that you don't know the people. What I'm saying to you, they have to reassess their whole management. That's where audit comes in. You need to audit everything that the CMO and them are doing. Audit what the medical doctors are treating. Put people on notice. I'm coming to check your notes. I'm coming to see if you treated this man properly. I'm coming to see what you did. And you need to get together as a group. Let us work on a better plan of action.
And if it is that you have the medical profession pushing back, saying that, we are against auditing because we feel it's a witch hunt and we're going to resist it. What do you do then?
Then we'll go nowhere. Then the CEO of the region will have to now take the notes, get a team of senior doctors together, randomly select the people who died from some other reason, and say, let us go through these notes. Tell me what you think. Write a report. What is your recommendations? What can we do different? Let us know.
Dr. Khan, we want to thank you very much indeed for taking the time to be with us this morning, and indeed mentioning the passing of Mr. Pooran Ramsingh, who was the founder of the Caribbean Glass organization. He passed away, and indeed so many people would have passed away over the course of the weekend, and indeed the numbers, how many of them, as we're discussing now, can be described as legitimate deaths because of COVID-19, or what's COVID-19 just an attachment to another situation or something that brought them in the hospital in the first place. 6:55 in Trinidad and Tobago. We're going to pause now to go to the news at the top of the hour, and then when we come back after the news, we move into the second hour of Morning Edition, starting with our Business Breakfast segment. We take a break now.